Get well soon. Planetary Health as cultural practice. Hello, my name's David Cross. I'm a reader in art and design here at UAL. And today I'd like to propose that by engaging with the concept of planetary health, art practices could shape the new understanding of the world that has been brought by COVID-19. Planetary health comes from the paradigm of science, so it's characterised by rational, instrumental thinking. Yet like entangled dreams, the ideals of ecological regeneration and restorative justice are marked by ideological and psychological complexity. It isn't the task of the arts and humanities to provide answers to questions, much less deliver solutions to problems. But art can test assumptions and generate ideas. Art can bypass people's rational defences and engage them in affective and embodied experiences. And art can create situations that enable people to reach profound insights and see new possibilities. The COVID-19 pandemic and the climate breakdown are both symptoms of the underlying social-ecological crisis. This global risks interconnections map from the free trade lobby group, the World Economic Forum, shows a web of interrelated risks that make up the crisis, with climate action failure positioned as the greatest risk of all. Interlinked with multiple other risks, including biodiversity loss and infectious diseases. The concept of planetary health could help. Set out as a manifesto in 2014 by Richard Horton and colleagues at the Lancet Medical Journal, and developed with the Rockefeller Foundation, planetary health is defined as the health of human civilization and the natural systems on which it depends. Western medical science is based on systems within the human body. Planetary health broadens health research to include the external systems that sustain or threaten human health. Planetary health is positioned at the intersection of health sciences and natural and physical sciences. One of the ways that planetary health relates the COVID-19 pandemic to the ecological crisis is in the link between infectious diseases in the health sciences and agriculture and biodiversity conservation in the natural sciences. Planetary health draws on the work of the Stockholm Resilience Institute, which has identified 9 planetary boundaries in the Earth system. 4 of these boundaries have already been breached. Climate change near the top of this diagram. Moving clockwise, we come round to nitrogen and phosphorus overload, mostly from agricultural fertiliser. Moving on again, we come to land system change and finally, destruction of biosphere integrity. Research shows that it was the destruction of biosphere integrity driven by land system change that enabled the COVID-19 virus to emerge late last year. Clearing tropical forests reduces and disrupts biodiverse ecosystems and allows diseases to be transmitted from wild animals to humans. While deliberate forest destruction may become recognised in international law under the crime of ecocide, we can already recognise it as an aesthetic tragedy. Tropical rainforests are home to the most significant biodiversity in the world. But they are not places of uninhabited nature. Tropical forests have been nurtured for thousands of years by indigenous tribes, such as the people of the Dongria Khond in northern India. Dongria Khond means protector of streams, and these people successfully opposed a mining project by the giant Vedanta Corporation that would have destroyed their forests and streams and erased their culture forever. We know that tropical forests are key to reversing climate breakdown because they lock up so much carbon. In the Amazon, the ancient practice of burying charcoal in the forest floor has improved soil fertility by holding water, minerals and nutrients, while also allowing the soil to store carbon for thousands of years. Research by the Rights and Resources Initiative in 2018 shows that by maintaining the integrity of their forests, Indigenous peoples and local communities around the world manage 300,000 million metric tons of carbon in their trees and soil. 300,000 million metric tons of carbon is a phenomenal quantity, and that is just going to be crucial in rolling back and reversing climate breakdown. The ability of forests to lock up carbon is of enormous importance for planetary health. But we also depend on forests for a whole range of medicines, including anaesthetics, antibiotics, cancer drugs, contraceptives, muscle relaxants and pain relievers. The forests of Indonesia alone are home to at least 6,000 medicinal plants, with researchers learning from traditional medicine practitioners to identify many more. So who would destroy tropical forests, and why? Well, among the worst destroyers of rainforests are palm oil producers. Research by the excellent Rainforest Action Network shows that popular snack foods contain illegal palm oil produced on destroyed rainforest land, even in national wildlife reserves. These snacks are brought to you by multinational corporations including Nestlé, Unilever, Procter & Gamble, Colgate-Palmolive, PepsiCo and Kellogg's, who list illegal palm oil producers in their supply chains. The multinationals are financed by a small number of banks whose logos you can see on the right-hand side of this graphic. Rainforests are also destroyed to grow soya to feed animals for meat and dairy production. In Brazil, farmers burn down the forest to graze beef cattle directly on the land. The Yale School of Forestry and Environmental Studies says cattle ranching accounted for 80% of Amazonian deforestation in 2015. That was before the election of Jair Bolsonaro as the president of Brazil. The Bureau of Investigative Journalism has traced supply chains to show that Amazonian beef is sold in China and in the UK, in Burger King, the NHS and the British military. JBS, the largest meat processing company in the world, exports beef from the Amazon to Europe and the UK. In 2019, an investigation by Earthsight exposed how supermarkets, Sainsbury's, Asda, Lidl and Morrisons stock corned beef from JBS, which supplies about half of the corned beef eaten in Britain. British-based banks and finance houses have recently loaned over $2 billion to Brazilian beef companies linked to Amazonian deforestation. John Middleton, President of the UK Faculty of Public Health, has charted the drivers of emerging infectious diseases. The two highest drivers we see here are land use change and food industry change. The lowest driver is bushmeat. Yet English language media reports have ignored the corporations and banks driving deforestation, and since the outbreak of COVID-19, they've focused instead on so-called wet markets, where wild animals are slaughtered and sold for food and traditional medicine. Medical research does show that wet markets enable zoonotic disease transmission. But the way this risk is framed by the media plays on a racialized fear of contamination, fueling dangerous xenophobia. It has often been said that COVID-19 does not discriminate, but the virus has had a devastating and disproportionate impact on people of colour. According to the Byline Times reporting in spring 2020, 97% of Britain's medical staff and 2/3 of NHS nurses who have died from COVID-19 are from Black, Asian and minority ethnic communities. In his 2020 book Sacrifice Zones, Steve Lerner has described how, in the USA, African American, Hispanic, Native American and Alaska Native, and working class white people are most exposed to harmful pollution levels. People of colour produce less pollution than white people, but are more exposed to it. The slow violence of air pollution has been followed in 2019 by months of confinement to limit the spread of a deadly virus that attacks the lungs. Then came the deliberate suffocation of a black citizen by a white police officer. The last words of George Floyd became a rallying call for people around the world who have united to condemn his murder and the structural racism that made it possible. Defending the right to breathe is a biopolitical struggle at the intersection of environmental and social justice movements. There are many racialised aspects of the social-ecological crisis, and the COVID-19 pandemic has only made them worse. Indigenous communities around the world were already suffering from overcrowding and a lack of clean water and healthcare, making them disproportionately vulnerable to disease. Indigenous peoples in Brazil now face the risk of genocide from COVID-19 brought in by illegal intruders on their lands. This pattern of contemporary injustice has a disturbing resonance with the unresolved historical trauma of colonialism. Following the invasion of Latin America by Christopher Columbus in 1492, European colonizers committed countless atrocities in order to subjugate and enslave the indigenous peoples. From their own land, the indigenous people were forced to clear forests and then mine gold and silver, which the colonizers stole from them and took back to Europe. The European colonizers also infected the indigenous peoples with deadly diseases like smallpox. As Alexander Koch and researchers at UCL and University of Leeds have shown, the resulting epidemics killed 90% of indigenous people. So many people died that their civilization collapsed and the land that they had cultivated for centuries reverted to forest, altering the climatic history of the planet. This so-called Great Dying of the indigenous peoples of the Americas contributed to what's known as the Little Ice Age in Europe, which has been called the most significant climatic event for the 8,000 years prior to the onset of global warming. Jean Ray has proposed that, in the sixth mass extinction, it's no longer permissible to think genocide apart from ecocide. In the end game of modernity, these processes are knotted and unfold from the same supremacist logics and fantasies. But what are the cultural roots of this disturbing phenomenon? In 1982, Fritjof Capra diagnosed what he called a crisis of perception, inherent in the dualistic separation of nature and culture, in the paradigm of Cartesian Newtonian science. Focusing on human health, Capra related the split between mind and body in Western medicine to the reductionist method of analysis. In reductionist thinking, and in the mechanistic model of the universe, Capra saw multiple interlocking misrecognitions driving ecological destruction, conflict, and physical and mental illness. Capra was heavily influenced by Gregory Bateson, who had brought together insights from psychology, anthropology, and systems theory to identify three interconnected networks existing at the scales of the human being, the society, and the ecosystem. Bateson focused on how these networks are all characterized by non-linear causality and dynamic feedback loops. Bateson's work informed Felix Guattari's thesis of the three ecologies, in which Guattari says, "More than ever today, nature has become inseparable from culture. And if we are to understand the interactions between ecosystems, the mechanosphere, and the social and individual universes of reference, we have to learn to think transversely." Now, I believe that as artists, thinking transversely is what we do. The further that science goes, the more it reveals what many artists have sensed for some time. That all matter, all energy, and all life forms are interconnected, endlessly changing and recombining in the most complex and surprising patterns. Earlier, I showed a diagram of planetary health as the intersection of health sciences and natural sciences. Although planetary health connects a vision of physical and mental well-being to ecological health and social justice, it doesn't engage with how health inequality is rooted in the racialized legacy of colonialism. Nor does it address the cultural dimension of our changing relationship to the planetary ecosystem. So I believe that the arts and humanities have a major contribution to make to planetary health. With their skill at pattern recognition, their fluency in handling scale and proportion, and their ability to combine creativity with criticality, artists and designers are constantly exploring new ideas and representations, framings and narratives. Combined with the cultural and historical understanding brought by the humanities, these capacities and tendencies could help bring about a deep shift in attitudes to physical and mental health as part of regenerative ecological practices and restorative justice. But what does all this mean in terms of art practice? Well, for UAL Research Fortnight last year, I put together a show of work by staff and students across UAL which explores the social and ecological dimensions of migration and displacement. The show was titled Steps to an Ecology of Mind, after the book of collected essays by Gregory Bateson, who I mentioned earlier. By engaging both with the concrete situation of migration and climate breakdown, and with the discursive frameworks around them, the exhibition aimed for different ways of understanding how visual culture relates to urgent geopolitical issues and to the values that might support collective action. I'm not sure if we can or should hold on to the models of art making and reception from before the pandemic. But to explore some of the issues around planetary health, maybe we could hold a workshop, stage an online exhibition, and perhaps make a publication of some kind. Following Gregory Bateson's model of an ecology of mind, we might ask a reflexive pair of questions. How might art change the world? And how might the world change art? Thanks very much for listening. If any of this is of interest, it would be great to speak with you. Maybe we can make something happen. So do please get in touch, and I look forward to speaking with you soon. Bye for now.